Hi, my name is Dr. Ross Hauser. You're at our Florida office of Caring Medical Regenerative Medicine Clinics. I'm going to actually show the digital motion x-ray of Brittany, who came in, and then later on you're actually going to see Brittany speaking of her response to prolotherapy. Why her case is interesting is that ever since she was 8 years old, she had so many problems. And one of the interesting problems that she had was numbness on her tongue. So she would turn her head and then she'd get this like horrible numbness of her tongue. She has lots of other symptoms, like terrible migraine headaches. She would get vomiting like once a week, terrible dizziness, blurriness in the eye, focusing issues, sometimes an inability to even work, like the symptoms are so bad, swallowing difficulties. Let me just see if there's anything else here. Vertigo, ringing in the ears. One of the things about digital motion x-ray is almost every time we scan somebody, we find something that you couldn't actually predict. Now, Brittany had lots of chiropractors taking care of her, and none of them ever said that she had a congenital fusion. And what you're going to see here is at the C2, C3 area, she has a fusion here. She was born that way. I mean, she didn't know that. So during the average day for her, this area can't move, like it's fused. So because of that and the forces of that, and maybe something happened when she was younger, like she fell, but she ended up with horrible instability above and below it. And you could see that Brittany, when she came in, she actually has what's called an S curve. Like the normal cervical curve is supposed to be a C. So just the S curve, by definition, means that the ligament support of the back of her cervical vertebrae, it's gone. So she has ligament laxity, ligament weakness, all in the back of her neck, which of course isn't helped by the face down lifestyle that so many people have with looking at their cell phones. So why don't we show some of the digital motion x-ray of her. We're going to watch Brittany's digital motion x-ray, and what we're looking for is there anterior slippage of one vertebrae on another? And that slippage is the amount of instability. So if we could run the video. And what you'll see with her video is these two vertebrae are fused, and below it we're going to see a lot of instability, so we'll stop it. Okay, so in other words, you could see where these two vertebrae are fused, they're in alignment, and kind of look at below the fusion, you'll see it's almost like a person's walking downstairs. See the posterior part of C3 here, then you have to go this way, posterior, to get to the posterior part of C4, then you have to walk down here, walk down here, walk down here. So she basically has instability at all the levels below her fusion. And if we go on the posterior part of C4, see this space here, that's the amount of instability at C3, C4. This is the amount of instability at C4, C5. That's the amount of instability at C5, C6. And then we could see even a little bit of instability at C6, C7. So there's a lot of instability. Now let's look at her C1, C2 facet joint and connection, and we do that through the open mouth view. We're going to watch Brittany's open mouth view to look at C1, C2, but I should preface it by saying that she was so locked down when she came in, like there was actually like no movement. So even the movement that you're going to see is after her suboccipital muscles were numb. And you'll see that she's very hesitant to even move, just because she has so much instability, but the body is clamping the muscles down so the C1, C2 doesn't hit vital structures such as the vagus nerve or the spinal cord. So you will see some overhang. So you could stop. You could see the overhang right here. That's the instability on the right side. Then we'll do the left side. Yeah, stop. And you could see there's only a little bit, But that's primarily because her muscles were so clamped down. The good news is that prolotherapy is very effective for this condition. And we'll now watch a video of Brittany talking about her response to prolotherapy. I'm here with Brittany, and Brittany's a tough case. She's a nurse, man. They're tough cases, but no, and you work in holistic care, so why don't you tell us kind of what you do?
I work at a holistic health office where we help cancer patients with IV therapy to supplement their chemotherapies if they're getting them.
You obviously are in the holistic healthcare field. You probably eat healthy, right?
Yes, I'm actually vegan.
Oh, you are? You're
Yes.
vegan, okay. And then why don't you tell us just a little bit of what was going on and why you decided to come for prolotherapy?
Okay, the deciding factor was that I was getting migraines weekly to the point of vomiting, having to pull over on the side of the road and vomit on my drive home from work. So that's what made me finally seek help. But since I was 8, I've had tongue numbness and pain in my neck, and my ear has been like closing and opening since I was that little.
No, but that's interesting. Like, that's basically since you were 8. So you've
Yes.
actually had kind of issues since then. Just out of curiosity, from 8 till now, did you get a lot of chiropractic care or no?
Since I was in my 20s, I've had a chiropractic care.
'Cause that's normally how. So the chiropractors have said they thought a lot of the stuff was your neck, a lot of the, and you've had other weird kind of symptoms. You're kind of a little bit weird. But no, what kind of other symptoms have you had? Like you.
I've had blurred vision.
Yeah, blurred
I've had
vision.
dizziness, nausea, menstrual symptoms. I've had, like I said, the tongue numbness, the headaches daily, stomach upset, GI upset.
Any problems hearing? Like,
Yeah.
usually when the thing opens and closes, that normally is that you got some hearing things.
Ringing in my right ear and blurred vision in my right eye.
Blurred vision in your right eye, and then occasionally you'll get like palpitations and
Yes.
different things. Then have you ever felt like you were gonna pass out?
Yes,
Okay.
yeah. When I had a palpitation episode, I did.
You've only had 3 visits, so tell us how you are doing after 3 visits.
I'm no longer having daily headaches. I no longer have migraines at all. The ringing in my ear has subsided to intermittent, and my tongue has not gone numb at all since I came here. And no more dizziness. My vision's getting better. And
No, that's awesome.
Yeah.
No, I mean, it's got to be kind of unusual for you, like the tongue numbness. Like you have it since you're 8.
Yeah.
Like 20 years basically, and then like
Mhm.
and then I'm sure you went to a lot of physicians and they really couldn't explain.
yeah, I've actually had 3 x-rays of my neck, and no one has caught the
Instability.
and the C2, C3 fusion.
Yeah.
Nobody saw that until I came here.
Yeah, so on your that's exactly right. Yeah, on your digital motion x-ray, you had a congenital fusion.
Right.
So that's what put all the strain on C1, C2. So you ended up with a lot of C1, C2 instability because C2, C3 was fused in you.
And the chiropractic was actually making it worse.
Yeah. The another unusual thing with you is that, when you first came, your uvula was deviated quite a bit. And then, we took pictures of it because it was an amazing uvula. So your husband, Joe, then didn't realize you had an amazing uvula. But no, and then today, after 3 visits, like if you look now, when you say, it's almost completely in the midline.
Right.
So in other words, we know that your vagus nerve is now functioning much, much more normally. And then, of course, you're starting to feel better.
Correct. Yep.
So we look forward to having you get all the way better, but thanks for doing this video.
Me too. Thank you.